Hey guys, how you doing? Ron Gigliotti with VIPER Emergency Medical Restraints, here with a couple of short videos on proper instructions for how to deploy your restraint, whether you are a right or a left-handed provider, and whether you're deploying it to the patient's left or their right side. So we'll go over some of the steps in these two different videos. So first I'm going to deploy this using my right hand, because I am a right-handed provider, to the patient's left side, because that's the side I'm on currently. So once I've gone ahead and I've let it unfurl, I will place the universal stretcher clip between my ring finger and my pinky. I will then take the soft restraint and place it between my thumb, my index finger, and my middle finger. This allows me to visually inspect that the restraint is not tangled up and that there's no twists in it prior to deployment. Once I do this, I will then grab the patient's left extremity by simply placing my hand through the restraint as I place the soft restraint on their lower forearm. Once I've done this, I will then take my left hand, or non-dominant hand, place it over the thumb recess. I will then lift up slowly, so that my thumb will go between the upper and the lower webbing, up against the curved aspect of the cam. This then allows me to hold counter traction, or pull counter traction, as I deploy. I will then pull in a steady and slow fashion, and then I will then take the gate clip and I will secure it to the pre-designated anchor points of either the stretcher, the stair chair, or in the hospital stretcher. I still have not let go, and I will not let go of the patient's extremity until I've taken up all of this loose webbing. So to do so, once the gate clip has been secured to an anchor point, your hand will basically just go up and grab the finger loop and pull counter traction as your non-dominant hand continues to maintain contact with the patient, assisting in taking up all of that slack into a position of limited mobility. Once you've done so, you want to go ahead and check for CSM. If you happen to find that the restraint is too tight or too loose, you can absolutely correct it right then and there. So in this case, I still have a little bit of extra slack. So if I need to tighten it, I will basically place my hand back in that position and just gently pull on that. Now, you can see that I took up all that extra slack. It's now not even moving, which means that I may have over-tightened it. To release that tension, you just press on the thumb latch just once. And what that does is it allows the restraint webbing to be released from between the teeth, but it does not allow the restraint to come off. Like I said, you don't want to over-loosen it, but you also don't want to over-tighten it. And that's basically all there is if you're deploying it to the patient's left extremity. So now what we'll do is just kind of reset for the patient's right extremity using my right hand. As there are just some subtle differences, we should discuss those real quick. I'm just going to go back into a ready position. So if I'm now standing on the patient's right side, this is my patient's right extremity, I will go ahead and unfurl it like I did in the previous. I will place the universal clip between my ring finger and my pinky again. I will then place the soft restraint with my thumb, my index finger, and my middle finger holding it in this open position, doing a visual inspection again to make sure that there's no twists or tangles. The difference between the patient's right side and the patient's left side is where I'm going to actually place my non-dominant hand. Unlike the patient's left extremity, where I actually fed my hand through, because this is the patient's right side and I'm on the patient's right side, I'm just going to hold the lower forearm while I place the restraint onto the lower wrist itself. And then the steps are the exact same. I will remove my non-dominant hand, place it over the cam itself like so that my fingers are kind of floating on top. I will lift up slowly so that my thumb can close between the upper and the lower webbing up against the concave recess. I will then go ahead and pull up the extra tension and webbing. Again, not letting go of the appendage. I will then go ahead and secure the gate clip to the pre-designated spots on the stretcher, the stair chair, or if you're in the hospital, and then repeat the steps for tightening. Again, you're then going to use your dominant hand to pull up that loose webbing, while your non-dominant hand assists in moving the hand to take up that extra slack into a position of limited mobility. You'll then go ahead and check for CSM, and then to make sure that the restraint is not too tight or not too loose, you'll repeat the steps. You can either tighten it, or you can loosen it just by pressing it just once, and that will loosen up all of that extra webbing. I hope that makes sense. If you have any questions, please feel free to reach out to us, and there will be another video for a left-handed deployment. Best of luck and take care.